You have been told cancer is random, but what if the system wants you to be passive? The cure is becoming somebody it cannot control. You have been lied to. Most of us want to be here. We want to stay healthy. We want to stay for our loved ones, for ourselves, for the people that depend on us. But the cancer prevention industry feeds on fear. It sells us hacks, detox tea, superfoods, avoid the bad luck. But according to the World Health Organization and the American Cancer Society, 40% of cancers are preventable. Guess what? This does not come from miracle cures, but it comes from you. It comes from your daily consistent at things that count. It comes from a process of becoming. So let's go ahead and dissect some of the myths associated with cancer prevention and causes of cancers. One of the popular myths is taking vitamins prevent cancer. The fact is that most large studies show no significant reduction in cancer risk from vitamin supplementation in healthy people. Organic foods will save me. The fact, it's not about the organic label. Organic foods will not save you without your habits. It's the dietary pattern that really matter. What does this mean? Diets that are rich in less processed foods, in more fruits, vegetables, grains, have been associated with a reduced risk of cancers. Number three, detox tea removes cancer producing toxins. Fact, your kidneys and your liver detox your body. Commercial detox tea can even be harmful if done excessively and they do not show significant cancer activity. If I do not smoke, I won't get cancer. The truth is, there are several other risk factors associated with cancers. Things like inactivity, alcohol, infection, all increase the risk of cancers. It's all about my genes. The fact is that only 10% of cancers show an inherited form. If I feel fine, then I am healthy. Truth, cancers take time to show up. They are known to slowly progress and it's easy for them to stay unnoticed. It is wisdom to accumulate cancer reducing habits in order to help reduce your risk. Prevention. As we know, prevention with regards to cancers, it's about a posture that you adopt. It's not about one habit. Reason being that we don't know a lot about cancer's causation and prevention as it is now. So there is no single bullet. Prevention is about a posture that you adopt and carry through all your life. I have invested time and done a lot of research around this topic, and I have now listed some of the things you could do with regards what age bracket you fall into. You could use this as a guideline. If you are in your 20s, consider HPV vaccination. It protects against 90% of cervical and anal related cancers. Avoid sun tanning. can significantly reduce your risk of skin cancers. Using SPF 30 plus helps to protect you even further. Quitting smoking as soon as you can reduces your risk of cancers dramatically. If you are in your 30s, now you need to start to look at your family history. What are the popular cancers in my family or popular health factors that I need to consider? Skin checks. Look out for moles on your skin and do some mapping around them, or areas of your skin that don't look quite normal, and map around them so you can discover quickly when they start to change. Lifestyle. Cancer and weight go hand in hand, so you need to consider all the time how to put your weight within the acceptable optimal limit for your height. HPV vaccination again is very important at this time, because you can actually have HPV vaccination even in your 30s if you missed it earlier. In your 40s, now you start to take on board so many other things like screenings for prostate cancer, breast cancer, colon cancer, and I say prostate cancer with a bit of caution, because there is a test for prostate cancer. However, you need your physician to guide you through. Those tests could give a lot of false positives. Breast cancer mammograms usually will start at the age of 50. It depends on the country you live in. It also depends on your own individual circumstances, such as a family risk of cancers. Lifestyle is very important all the time, even more so now. Watch out for weight when it starts to creep in, stress, sugar. Do one thing at a time. Don't get overwhelmed with, oh, I'm doing so many things. It is a posture you're adopting and you have decided to carry through as long as you live. In your 50s and beyond, you need to double down on screening, vaccinations for HPV, for hepatitis B, shingles. Stay active. Walking at least 30 minutes a day, 5 times a week, reduces the risk of colon and breast cancers. If you are in high risk jobs, construction jobs, jobs where mining, always use protective gear. Wash up when you've left work. Try to change your clothing before you get into your home, and raise symptoms as soon as they appear. Saloon, factory, jobs that are prone to exposure with chemicals. Use your protective gear. Use things like filters around your work environment to keep purifying the air that you breathe in, and take note of symptoms when they start to show up and discuss them. Night work, so shift work, night work affects your circadian rhythm. Now that's the sleep rhythm, and it's been shown that night work and anything that affects the sleep rhythm increases the risk of hormone-mediated cancers. So try to get your sleep in, get quality sleep when you can. Use other methods of maximizing the quality of sleep that you get. So having a sleep regimen or sleep hygiene, eating at a particular time of the day, and maintaining a routine that your body can adapt to or work with regard to your shifts that you do at work will also help. As a family physician, This is something I hear all the time. I used to do so many things to help me stay healthy, but somehow along the line I fell off my routine. Don't quit. Pick yourself up and start again from wherever you are at that point. Because we know for sure that prevention is going to stay with us all our lives. So even if you fall off your routine or your habits, just start where you are again and stay true to yourself. Sometimes we get overwhelmed with life and we start to pick and choose what should stay. Make sure that this one stays all the time so you do not erase the effort that you have made over the years. I hope this has helped somebody. Please put your comments down below and let me know what next you want to watch. Alright then, have a fine day. Bye.